Good afternoon, one and all, and welcome to another session of Ask the Expert. This session is facilitated by Grenadian medical professionals in the diaspora in collaboration with the Office of Diaspora Affairs. Today, I am Trisha Mitchell-Darius, and I will be your moderator. For the previous sessions that we've hosted, a lot of the content has been heavily focused on medical terminologies as it relates to the vaccine and other issues. Today, we're going to take a pause from that, and we are going to focus on some other initiatives that are currently underway in the diaspora to provide support for Grenada during this time. Aside from the obvious physical impacts caused by COVID infections during this pandemic, experts have also identified other areas for both individual and community support, like mental health, social supports, and of course, we have our economic impacts. Today's guests are representatives of diaspora organizations working across the US, Canada, and the UK to provide individual and community support to Grenada. They will be joined by local government and volunteer recipients to discuss how these supports can and are to be accessed on the ground in Grenada. Today, our first panelist that I will introduce is Mr. Unison Joseph. Mr. Joseph is chair of the Grenada Disaster Preparedness Toronto Group in Canada. He is currently coordinating the Canadian arm of the diaspora response, working in collaboration with other diaspora groups in the Canadian space. Mr. Joseph, welcome.
Thank you, Tricia. Thank you for having me.
Our next panelist that I will introduce is Ms. Wandalyn Peters, who's a medical doctor. She is an adult and pediatric psychiatrist based in Florida, and she's part of the group of Grenadian doctors from the diaspora called the Grenada COVID Crisis Group. She is charged with leading the emotional support portion of the group's response. She's currently focused on collaborating with Grenadian psychiatrists to expand their ability to provide services virtually and in person during these times of high stress for everyone. Welcome, Dr. Peters.
It's a pleasure to be here.
And we also have Dr. Margaret Joan Joseph, who's an obstetrician, gynecologist, and former consultant specialist at the General Hospital St. George's. At present, she's the convener of Telemedicine Team Grenada, which is a volunteer service group adding a new modality to the Ministry of Health's capacity to manage the COVID-19 pandemic. Welcome, Dr. Joseph.
Thank you. I'm very happy to have been invited by the organizers. Thank you.
And last but by no means least, we have Mr. Derek James, who is a director of the Office of Diaspora Affairs, and he's charged with coordinating the diaspora response to the COVID-19 pandemic. Mr. James, welcome.
Thank you, Mr. Darius. Welcome to everybody on this panel. It's a pleasure being here.
Thank you. So what we're going to do is we're going to do a little bit of round robin to start. So I am going to get, in the order that I introduced you, I'm going to get you to tell me just a little bit about your organization and to sort of give me a status update as to where you're at in terms of your organization or you individually response to the current pandemic. So we will start with Mr. Joseph.
Thank you, Tricia. And to my fellow panelists and viewers, listeners, a pleasure being on this program. Just to give you a brief overview of the organization, the Grenada Disaster Preparedness Toronto was formed in 2017 with a motto for love of nation. Our aim is to mobilize immediate assistance and training to alleviate the impact of a disaster on Grenada, Carriacou, and Petit Martinique. We are a federal registered non-for-profit organization in Canada. We have affiliated ourselves with great organizations like Global Medic, which has been a great friend and ally to Grenada. Some of the things we have donated so far to Grenada is firefighting equipment, which were donated by a Grenada firefighter in Toronto, Neil Nicholas, as well as surgical face masks and hand sanitizers. During the current pandemic, we were approached by the Office of the Diaspora for assistance in mobilizing support for Grenada, in which we approached the Grenadian community in Toronto with the coordination of the mission here. And we purchased 4 to 5 gallons of hand sanitizers from the Grenada Distilleries Limited. With the assistance from these organizations, the Toronto Nurses Association, the Grenada Association Toronto, the Boca Support Group, a check was made payable to the aforementioned company for which items was purchased, which was donated to the transportation sector. A total of 3,300 Canadian were raised from this drive. To date, we have sent 60,000 bottles of hand sanitizers, 102,000 surgical face masks, which were donated by the Black Transit Workers Association Toronto through their president, Kyron Lewis, with 15,000 rubber boots, among other PPEs which were donated. Currently, we are working with the Grenadians in the diaspora through the Office of the Diaspora and our mission in Toronto to strategically coordinate our efforts in fighting COVID-19 in Grenada. So that's where we are at this point with our efforts.
Thank you, Mr. Joseph. Dr. Peters?
Hi. So I'm a part of the Grenadian COVID crisis group, which has specialists, every specialist possible. Some of them are on the ground right now, but most of us are still abroad. The idea of the whole organization is to see what we can do from outside to help shore up the local response to it, recognizing the rapid number of deaths and the intensity of the spread within a very short space of time in Grenada. For most of us, that's followed like 2, 3, 4 waves of COVID where we live in the United States and elsewhere. As a psychiatrist, I do general and adolescent and general child and adolescent psychiatry. And so as a psychiatrist, my part of the whole thing is to help with the mental health response. But the organization itself has raised money through a good bit of money through GoFundMe, as well as collecting donations of PPE and other medical supplies for Grenada as well. But in terms of the mental health response, my responsibility, along with the others who are working with me, is to help Grenadian psychologists and psychiatrists both be able to see a greater number of patients in a greater period of time than would otherwise be possible. And so what we're doing is working with the Ministry of Social Development in order to provide, to try to make telemedicine, telepsychiatry available at district offices, and hopefully even eventually in the smaller offices or surgeries throughout the parishes, so that it's accessible to everybody. I think at the end of the day, the main mission is for people to understand that it's okay to not be okay, that it's normal to be somewhat stressed during this time, and this is not a good time to sort of take it on the chin and pretend that everything's okay, but rather to reach out and get help when you need it, because you will find that it's there.
Thank you, Dr. Peters. Dr. Joseph, over to you.
Thank you, Tricia. I am the convener of the telemedicine group. First of all, I would like to say thank you and to the diaspora desk in the ministry, and to the COVID group that Dr. Peters belongs to, because they have reached out to us, and they have been watching what we are doing, supporting what we are doing, and they even made us a gift, which is a shipment of pulse oximeters. I like to show it off whenever I can. I have a sample here of the gift that they got to us. It actually they got this through a charitable organization in the United States, and they've made the shipment available so that we can reach out to as many people and monitor as many people via telemedicine as possible. And our target group that we want to work with would be Grenadians people on Grenada, let me say people on Grenada who have been found to be COVID positive and who are in isolation. We would now be the service to follow them, to counsel them, support them, monitor them, and treat them online. Now, we brought this idea to the Chief Medical Officer on the 1st of September. And since then, we have been working with Flo and with the Ministry of Health to finally bring this on board. On Monday, the 11th, this last week, we've been up and running. And we've been taking calls on the hotline. And at a later point, maybe I will get an opportunity to give the telephone numbers, perhaps. So we are basically 20 healthcare workers, 20 healthcare professionals, and among us, there are 18 medical doctors. 2 of them work in psychiatry, so we have a bit of support of that type at this time. And we have 2 nurse counselors. These nurse counselors were actually deployed by the religious community, because one was deployed by the Roman Catholic Bishop Harvey, and the other is a pastor from the Seventh-day Adventist Church, who also has counseling training and is a nurse by his early training. So we are really happy to have all these people, all these healthcare professionals who can help us to reach out via the telemedicine modality. So we are there to support.
Thank you, Dr. Joseph. Over to you, Mr. James.
Thank you. First of all, let me say good afternoon to the listening public, and to say thanks to all the people in the diaspora for the support during this difficult time. I want to start off by saying that the first call came for support to the Office of Diaspora Affairs from the Ministry of Transportation. And since that day, we reached out to the diaspora and developed a strong structure that will assist in all the donations that we're receiving, whether it is human skills transfer or if it is material support. And I want to use this opportunity now to say thanks to all the organizers, the committee that coordinate this activity with me, the activities, to all the teams on the ground who collect material to send to Grenada. I want to say thanks also to Dr. Radix on Friday and the team, the CCG, for the efforts, and they have been working along with us. We coordinate all our activities. They are part of the coordinating committee. The organizations and individuals in the diaspora, those that on the ground here in Grenada, Carriacou and Pedimatic, the nurses, the frontline workers, the Ministry of Health, the Ministry of Hospital Services. We have been working with all of them. And more than anything else, I want to say thanks to SGU for the support. They have been working with us in picking up supplies from all over the diaspora to get here in Grenada. And if I cannot say anything else without saying thanks to the broker, the customs broker, who played part in collecting, claiming the stuff from us from the customs officers, and the Ministry of Health, Ministry of Foreign Affairs, the ministry I belongs to. I want to say thanks to all of them, because it's a collaborated effort and it's a huge undertaking. And we have been doing this and meeting every week to coordinate our efforts, to see where we are, work with the Ministry of Health to see what is important, what we should move on the list as priorities. And so we get the information out to the officer, to the diaspora. We have been able in that period to develop a website with all the information that is needed for people in terms of donation, where they could make the donations, what are the priorities, what are the things on the priority list. All of those things is on a special website that everybody could go to the Office of Diaspora Affairs, and from there you could get onto the website. You go to COVID response and you get it, Response Grenada, and all of that is there. And to the people who continue to ask us for support, we reach out to them. In fact, there are times when people in communities reach out for support, and we offer support to them by giving them hand sanitizers or masks and so on. So it's not just the ministries of health and hospital services that receive some support, but also the communities receive support from us. And we will continue to do that. And I want people to understand that as time move on, the priorities change from one thing to other, and we will always post those things on the website, and I want people to understand and support when we make the change and to understand why the changes are necessary. We are lucky in Grenada to have COVID at this time, the first wave of it at this time, after all the major countries have theirs, because we were able to mobilize our diaspora, and we were able to get the support we get from the diaspora in this time. If that will happen during the early time, we would have struggled like any other country who struggled in the early days to get support. So because of that, I really want to say thanks to all our professional doctors and nurses, all our ordinary man and woman on the street in the different parts of the diaspora who put on the boots and come out and really, really help in this difficult time for Grenada, Carriacou, and PT Martinique.
Thank you, Mr. James. On that note, you spoke a lot about the coordination website, but you have not given the exact address for that website. So I think our listeners would appreciate having that information. As well, you've spoken about support in general terms. Are you able to give us a more sort of I know it may be difficult to give a very detailed breakdown, but can you give us maybe a dollar figure for the value of support that have been garnered from the diaspora to date, or
Sure.
most recent?
Trisha, well, I should say this. There's been a lot of support that came to Grenada without we knowing. Individuals sent things, and it was not through the Office of Diaspora Affairs or through the structures that we have. And to them, I want to say thanks to them for what they have done. But in terms of what we have monitored, what we know as a fact that reached to Grenada is over 2.5 million EC dollars of supplies came to Grenada from the diaspora. And you cannot put a value to the human skills transfer, the doctors and so on that came. But in terms of the supplies, 2.5 million EC dollars already came to Grenada. And that number is still counting. In fact, only this afternoon, I got some new numbers from London as to where they are in terms of the donation. So if you ask me tomorrow, we will have a new figure. But we keep on updating our numbers every day. We have had support from all over the diaspora. So to tell you, we have a breakdown. We have an elaborate system where we have every person who donate. We know who they are. Every item that was sent, we know where the item is in terms of whether it is being shipped, whether it's waiting to be shipped, when it gets to Grenada. And when we send out the last piece of it is when we send out a thank you letter to the people who made the donation. So we have that tracking to know who received thank you letters, who did not receive it, to make sure that everybody who make a donation receives a thank you letter.
Appreciate that. You did forget to say what the website was.
Oh, okay. The diaspora website is Grenadian, GRENADIAN, diaspora.gd. That is the website. And on that website, you go to COVID response and you could get it there. Or you could go to responsegrenada.com, and you could find the website with everything you could think about what is needed, what we're doing, with the drop-off support, with the purchase and things, what is needed. All of that is there on the website. And that website has been created specifically for the COVID response.
Thank you, Mr. James. And I would echo your thanks as well to all the persons in the diaspora who have contributed. I think one of the things that's always been said is the further from home Grenadians are, the more Grenadian they are. And I think in this particular instance, as with other times, you know, Grenadians in the diaspora have a track record of, you know, when a call for assistance comes from Grenada, in any time of need, Grenadians are always willing to put on their boots, as you say, and to jump in there and to do whatever they can. So thank you for
Tricia,
that.
one of the things that also happened, which is we really thankful for, is a lot of people in the diaspora, they got links for us. They contact other institutions for us to reach out to, or they themselves went to these institutions and get support for Grenada in this time. So that those institutions that we receive support from, we also want to say thanks to them, you know, and we will ensure that they receive the appreciation that is needed.
Awesome, thank you. If we can shift over just a little bit now. So we're dealing with we've dealt a lot with the equipment support and sort of the monetary support. So thank you, Mr. James, for that. And also, Mr. Joseph, I know that you are knee deep in all of that, particularly coming from the Canadian. And I'll look back to you in a little bit, but I want to jump to Dr. Joseph. We have a question here. You mentioned that there were emotional supports for persons coming in through telehealth when they call that COVID hotline. I'm assuming it is. What about persons who are unable to access that service, or persons who do not have internet but they need help? How are they being monitored in isolation?
Okay, now your question started with psychological or emotional support, and then went on to monitoring. And when it comes to monitoring, the different types of monitoring, you know, there is the clinical or medical monitoring, as well as the psychological and emotional monitoring. So we, our focus, well, first of all, because we are 20 healthcare professionals, everyone has training in counseling. There isn't, I cannot think of a doctor who has not received training alongside their medical training or within their medical training in counseling. So every healthcare professional has that as a part of their professional activity, their professional training. So, and anytime one comes in touch with a doctor, there is some element of counseling going on. It may not be the elaborate psychological counseling that Dr. Peters is interested in mounting with her group, but there will be aspects of that. And in addition, we actually do have trained counselors who are specifically trained in counseling with us. So in terms of that, that is what is available in our service. And it comes under the Ministry of Health, I must say, because we, in our initiative, started with the Chief Medical Officer, and we are all medical personnel in Grenada. In terms of having access to the internet, we are online with use of the technology referred to as VoIP, which is Voice over Internet Protocol. However, this is accessed by simply your phone, your cell phone, your landline. That's basically it. And maybe this is a good time for me to mention the numbers because it seems relevant. It seems relevant right now. So the numbers are 438-4787, 458-4787, 538-4787. So 4787 is constant, because for memory purposes, if you're using the lettered keypad, it amounts to 43 virus, 45 virus, and 53 virus. So 438-4787, 458-4787, 538-4787. So the caller does not necessarily have to have internet service, but they do need to have access to telephone. And if they have a cell phone, they need to have enough top up so that they can talk with the hotline or talk with the telemedicine team member for at least 15 minutes. You know, they need to have that ability. And I mentioned the Ministry of Health, but I would like to point out that the 18 doctors are all members of the Grenada Medical Association. So the Grenada Medical Association is represented and basically is the organization that, even though we may have initiated it as a group, we belong to that larger parent group called the Grenada Medical Association. We also have been invited, as I said, the diaspora doctors did reach out to us and invited me to a meeting to see how we could collaborate. And my understanding is that they're going to do everything to not just in terms of the monitoring, which I must deal with according to your question, but they will do everything to work with us as going forward. Now, in terms of the monitoring would be done by a system of callback. So it means that the caller has to be ready to call back to, in other words, come back to us for the ongoing monitoring. And this is decided when the person is assessed, because anything that one wants to do in the medical field, as in any other field, there must first be an assessment. So once they are assessed, we will then assign to them whatever type of monitoring they require. If it is that they need emotional or psychological support, we have that, and we can simply make contact with them or invite them to make contact with us again at a prescribed time, at an arranged time. In terms of people who are positive with COVID, of course, the big fear is that such people could deteriorate medically and begin to need hospitalization, may become seriously ill with the severe stage of COVID, or become critically ill, and would then be, the fear is, in danger of death. Now, we know that it is not everyone who becomes infected that dies, but everyone who becomes infected would be afraid that they might end up in that serious condition, hence the emotional support. But in terms of the monitoring, what we have found is that as doctors, we know that it's a respiratory illness at the end of the day. And the chief function of the respiratory system is to get oxygen into the body. And any living organism that doesn't have oxygen on this planet will die. And so we want to monitor the person as they go along to find out if they need oxygen therapy. And the most important tool is what the diaspora doctors actually presented us with. And once we assess people, we make it possible for them to reach out and receive one of those. We have also sent some of these same units to Carriacou, to our colleague there, so that Carriacou and Petit Martinique, and he travels between Carriacou and Petit Martinique. on a weekly basis. So Carriacou and Petit Martinique are also taken care of because they are part of the state of Grenada, and we will never, ever separate or leave them off. So that's, I think I feel as if I've said enough for the moment.
Yes, you have. Thank you. But just one quick follow-up. Can you tell me a little bit about the self-assessment that persons in isolation should be doing to prompt them for the need to call your hotline, to call the hotline? What indicators, what should they be looking for? If they're in self-isolation, what should they be looking for that should prompt them to call in?
Well, that's, I thank you for that question because it's clear. Well, I need to make it a little clearer. Now, when people become severely ill, what they experience would be breathing problems, and they would not be getting enough oxygen. And this shows up on the body by blueness around the lips, or a grayish or bluish color around the lips, and even the fingertips and so on. The person who might have been quite collective before might suddenly become confused. So this is what we would call a new state of confusion. They may experience chest pain, chest heaviness, and shortness of breath. So when any of these things occur, they should not wait. They should get in touch with us. However, our frontline workers have been very concerned that people are waiting until too late. And actually, what I have just described is the late manifestations of the condition. When we really hope that people will get in touch with the hotline to the telemedicine section when they know that they are COVID positive, so that we would go through a process of registering them. And then we will give them the basic simple advice. The main thing, one of the main things that people tend to forget is hydration, drinking enough water. And most adults in this hot weather that we're having now, most adults will require at least around 3 liters of water. That's 3 of the bigger Grenada water bottles, the 3 liters per day. And they should, in spite of everything, keep well hydrated, follow a good healthy diet, which will contain fruits, vegetables, protein, and all the food groups. At the same time, they should be taking some kind of vitamin, like vitamin C, vitamin D. We've heard these mentioned quite a lot. We've heard of zinc. So one can go to the pharmacy and get, I don't mean that the COVID positive person should pick themselves up and go to the pharmacy because they're in isolation. But you would normally institute a system where someone in your family or a neighbor would do the shopping for you. So the same person who does the shopping would be the person to go to the pharmacy and make sure that these things are put into the home. There are other supportive medications in case they start getting a fever and so on. If you have an antipyretic such as paracetamol there. When the thing about it is when we assess them, we will decide, is this person, because of what they tell us, is this person over the age of 60? Do they have any underlying or what is called comorbidities? Is the person pregnant? Is the person an asthmatic? So the comorbidities that are most common in Grenada would be diabetes and hypertension, but any other form of disorder like an autoimmune disease and anything that comes out from the person's history, we would use that Pregnancy is one. I have to say that because I am an obstetrician gynecologist. So pregnancy is one of the high risk factors. So any such people would be assessed and, if necessary, would be given an oxygen monitor, which is called a pulse oximeter. And they would be shown how, they would be tutored online how to use it. And they can use this to monitor that their oxygen level remains within the normal range. We don't want any oxygen definitely below 90, but we actually have a higher cutoff point, and 94% saturation is what the telemedicine team, Grenada, and what many of the centers in the English-speaking Caribbean, we are using that cutoff point of 94% oxygen saturation. So we are, anything below 90 are definitely very dangerous. So this is part of the monitoring. The rest of the monitoring is the person's mental status. And I don't want to tread too much in Dr. Peters' area, but the general mental status is always of importance to the healthcare professional. After all, we want to know when to refer to Dr. Peters, you know. We are going to look at their mentation, and this may, are they able to carry on a conversation? This may tell us whether they are having some problem with breathing, because just the way a person speaks, we have actually prepared ourselves. In fact, we started our preparation since February to March of 2020, and we again escalated it with the community spread. So we are all acute, listening very sharply to hear how the person breathes while they talk to us over the telephone. And then we are going to ask them certain things. So all of these aspects of the monitoring would be very important. We'd also ask them to tell us, is there anything different? Do you feel in any way different than you felt before? In other words, whether there's muscle ache, weakness, loss of taste, loss of smell, and that all of those symptoms that we know have become so characteristic of the COVID disease. So,
Thank you.
Was there? Thank you.
Thank you, Doctor. Thank you. You've been very thorough. I appreciate that response. I have another question for you, but I'll go to the rest of the panel and then I'll come back to you if that's okay. Wonderful. Dr. Peters, if I could move over to you. Can you give us a sense as to where you and your team are at in terms of your service getting on stream? And will you be utilizing the same hotline that Dr. Joseph has spoken of? And as a follow-up to that, is there any if you are intending to use the hotline, is there any consideration being given to an alternative to the hotline? Because we've had several complaints of persons being unable to access the hotline.
Let me go ahead and start with the resources first. I think because it's important for people, if for nothing else, that they walk away with, what do I do when I'm having trouble? Whether that's that I'm feeling down or stressed out or whatever it is, and we can cover those symptoms. But in addition to the numbers that Dr. Joseph gave, my understanding is that for the Ministry of Social Development district offices, that there are several of them, one in every parish, but the main office is in St. George's, and that number is somebody's there from 8 a.m. to 4 p.m. and that's 440-2269, 440-2269. For the main district office for social development, and then they can provide the numbers that people need for the other district offices in order to get help. But outside of the hours that office in St. George's is available, and they're only doing telemedicine as well. Because so far they don't have really the infrastructure to do the 6 feet apart and so forth. So they're primarily doing telemedicine as well, and they will do it with with a regular voice call as well if the person doesn't have internet access. But outside of those hours, another helpline from them is 440-4787. That's 440-4787. And people can, get help there. I wanted to go through some other resources that are not unique to Grenada as well, because I think everybody knows already that there's a lot of stigma attached to not only coronavirus, but to mental health or the need for emotional support, throughout the Caribbean. And so I think it's important for people to be able to figure out where they can get help otherwise. And so just about like a month or so ago, Venus Williams, the tennis star, decided that mental health had become such an issue after some of the American athletes came out and said that they were having issues, that she's decided to partner with an organization to provide free therapy online for a month. And so I think that's very important because it's completely anonymous. You're one of millions. Nobody knows who you are or who your neighbors are or who your family is. And so that's really important. It's betterhelp.com/Venus. That's betterhelp.com/Venus. And you can sign up online and get a month of free therapy there. But one can also access psychiatrists through Talkspace or Teladoc in the US as well, in order to get the help that they need. And then the last thing in terms of resources that I wanted to point out is that I think a lot of people have misinformation, especially available on social media, and that scares them about the potential for taking a vaccine, et cetera. And so I think it's very important for people to have good sources of information that are reliable. And so the CDC has, the Centers for Disease Control in the US, as well as their foundation, have put up a site called coping19.org. That's coping, COPING-19.org. And it's a curated place where you can get information of any variety about COVID, whether it's about vaccines or physical symptoms, or whether it's emotional health issues. So I think those are important places for people to access, because we keep talking about people being vaccine hesitant, et cetera. And I feel like what we call vaccine hesitant, for the most part, is people who have a lack of information. Like somehow it's not been presented in a way that they can understand the benefits and the risks associated. And so there's an excessive amount of fear that makes them not do it. So those are the things. The other part of your question is in terms of what the Grenada COVID crisis group is trying to do with mental health, right? And so
Yes.
our idea is not to sort of recreate the wheel or impose our will, but to collaborate with the people who are on the ground. So that's with Dr. Joseph's group, as well as with the psychiatrists in Grenada and the psychologists there. And that's why the person that I've been communicating with so far is from the Ministry of Social Development, because there's a need for a lot of psychological support, and we want to get it out, to as many places as possible. But I'm not sure if there's going to be another opportunity to say it, or if you want me to say now, like when people should know that they should reach out for emotional support.
Please, that was going to be my follow-up question. So thank you.
Okay. All right. So I think this thing has been going on for a year and a half already. So everybody has had some, level of impact with it, been stressed to some degree, right? Especially in the periods where we're all locked down together. And in Grenada's case, kids still being at home for school right now, virtual school. I think that's a very kind of pressure cooker situation sometimes. And so if you are a victim of violence of any sort, whether that's child abuse or domestic violence, of course, those are situations where you should reach out for extra help. But as I say, everybody can be a little bit stressed about the circumstance. But if you notice that for more than a few days at a time, you're not able to sleep properly, we actually have a name for it now, coronasomnia. I think a lot of words came up with coronavirus, that pandemic, but coronasomnia is a recognition that there is sleep impairment on a wide scale for a variety of reasons. Sometimes it's because there's a higher rate of depression and anxiety with the whole pandemic and the financial situation associated. Sometimes it's a big change in our schedules, et cetera. So for a variety of reasons, people aren't sleeping well. And so somebody just put up there, so before I forget, I'm going to do it. Somebody just put in the chat to repeat the helpline, the place for free therapy. I'm going to do it right now before I forget. It's betterhelp.com/Venus. betterhelp.com/Venus. So if you recognize that more than 3 or 4 days in a row you're not sleeping well, if you start having thoughts for sure about wanting to hurt yourself or someone else, like suicidal thoughts, if you realize that, and this is the main thing for us as psychiatrists, is not just the symptoms that you have, because we all have various symptoms at some time, but to what degree are you functioning? So that is in your role as a parent or an employee or a husband or a wife or a student, whatever it is. If you cannot fulfill your typical role obligations in the way that you should, then that would say, you should reach out to get some help.
Thank you. So what I get from you is that your team is working to support Dr. Joseph and their objectives, and to provide additional support from the perspective of through the hotline. Correct? Right,
but also for the psychologists and the psychologists. I think Dr. Joseph's group is a group of physicians only, so they may be more focused with helping with the psychiatrists, but we want to help the psychiatrists as well as the psychologists on the ground who are inadequately staffed in Grenada.
Right. So I'm feeling I'm maybe experiencing one of the symptoms that you've just told me to look for. Do I need a referral from my doctor to reach out? Should I be
Not
reaching
from
out
anybody.
To my physician?
Not from anybody. I think that's just sort of putting another obstacle in the way. If you recognize that you or somebody in your family is struggling, then you should call one of the numbers I gave or one of the numbers that Dr. Joseph gave immediately, because there's no harm, in getting an assessment. Maybe it may be a situation of just talking through something, one session or several sessions, or it may be a situation where at least for a short term you need some medications, but there's no harm in reaching out for help. And so we don't have any barriers in the way of who you need to see first before you access the help, for sure.
Sorry, go ahead.
No, I was going to say, one of the things that we know for sure, as I talk about like child abuse and domestic violence, is that when people, and even Hurricane Ivan, but when people haven't dealt with whatever traumas in their lives have happened in the past, and another one gets layered on top of it, we know that those people are a lot more susceptible to decompensating, not doing very well. So a lot of it may have come from stuff that was going on long before coronavirus ever came on that wasn't dealt with. So if you know in your heart of hearts, whether you've spoken to somebody else about it or not, that you need help because you're not functioning well, then we would urge people to reach out for help.
Thank you. Now, this question comes from the audience and can be answered by either Dr. Peters or Dr. Joseph. In the context of Grenada, we are a very small, tight-knit community. Can you speak to the confidentiality of accessing some of these services? Because we do know that there is definitely a stigma around, saying that you're not okay, or, reaching out for any type of mental health support. Can you speak to that?
Okay, I'll go ahead and start. I think that's one of the things that I think is taking us a little bit of time to get off the ground, because there are platforms that are more what we call HIPAA compliant. They comply with the laws in the US for confidentiality. In other words, they're harder to hack into. And so we want to make sure that we're using something that fits those parameters so people can be more protected. But I think when we talk about people being afraid about confidentiality issues, it's not about like sessions being hacked into. I think what they're more concerned about is, my brother or my sister or my neighbor, and you're going to say something that I came in and so forth. And just so they know, like, that is an absolute no. Like confidentiality is 100%, guaranteed, because how can you talk if you're not in a space where you feel safe to do so? And that's why for me, it's something critically important that we actually have mental health available in places that are not only associated, with psychiatric issues. I feel like sometimes people in Grenada might be afraid to be seen walking into Mount Gay. And that's why my ideal situation would be that the same place you get bandaged up, whatever, the surgeries, whatever, the same place you go when you have a really bad cold, whatever it is, can be the places that you can see somebody to deal with emotional support. So we can remove that layer of stigma. But for our part as mental health practitioners, confidentiality is key, and we're not allowed to release information to anybody without people's signed consent.
Thank you, Dr. Peters. Dr. Joseph, do you have any anything to add?
I should just speak directly to the telemedicine team on the hotline. All of the persons involved in the hotline, all of the persons involved in the telemedicine team are trained medical professionals and have among them and between them a large wealth of experience. And they are absolutely committed to confidentiality. I know every single one of them, and they are absolutely committed to confidentiality. So that I can say with confidence. And this is an obstetrician gynecologist speaking, and I'm someone who deals with a specialty which is extremely sensitive when it comes to confidentiality. And I can say that everyone on my team is completely committed to confidentiality. I think that's all that needs to be said.
Okay, Dr. Joseph, don't go just yet because we have another question that I think falls in your wheelhouse. Is there any service for persons who want to make a one-on-one appointment with a doctor about if they should get a vaccine? I mean, this is a little, I don't know if this question actually falls within your wheelhouse, but I think it does. So the person wants to know, does the hotline cover this?
If someone wants to talk with one of our medical practitioners about in a one-on-one, in fact, everything is one-on-one right there. If they want to talk about the vaccine, and I believe you said whether they should take it, then yes, of course, every health professional on the team will and can speak with you about that. The answer is absolutely yes. Absolutely yes.
Thank you. And another one for you. You're very popular today. One of our audience members wants to know if your team, your telemedicine team, receives a list of the COVID positive persons, and is it part of your mandate to reach out to those persons one-on-one, or is it that these persons, once they've received a diagnosis, they need to reach out to your team?
We do not at this time have a mandate to hold a list of the COVID positive people, no. And we simply invite people to reach out to us when they listen to programs such as yours now. And we have had one or two other ways of letting people know that we exist. And we should be looking for more to let people know that we exist. We also, what I have done is request the nurses who actually give the results to let people know that this service exists, because it is the same hotline that the Ministry of Health has operated for more than a year. This hotline has existed. There's only one new number that I've seen, and that's the 438 number. The other two numbers have been in use for more than a year. So the nurses are very familiar with it. And I have simply asked them I have personally informed at the top, basically, the nurses in charge. And I've asked them, please, to share this information with anyone who you give a positive result. If you give someone a positive result, you may have another person in line and you won't need to move on, but please give each person who is told that they're positive the ability to reach us by giving them the information that we exist and what is the number they should call.
Awesome. Thank you so much, Dr. Joseph. Okay, so we're going to shift in the absence of any other questions, we will shift the discussion back over to the sort of diaspora-driven initiatives that are currently underway. And if I could ask Mr. Joseph to give us a sense of where your organization is at in terms of what should I say, in terms of pulling together support from the Grenadians who live in Canada, or
Yes.
also who are you currently working with any corporate partners for your drive?
Yes, thank you. We have received a tremendous amount of support from the Grenadian different organizations in Toronto. We work with Global Medic. Global Medic has been in Grenada during Ivan. They do the mapping. And they also supplies us with hand sanitizer, face shields, a number of different PPEs on the ground. I have to say our mission here and a new person in the consulate have been also helpful to us. They've been providing support, which is very critical in terms like this, and I'm gathering support. So the Grenadians here, when things happen, we always pull together, and this was no different. This drive was made much easier with the coming on board of a diaspora desk. And by that, it has streamlined a lot of different avenues in which we could funnel our resources and also keep us accountable for what is donated to us. Because for all, the personnel on the ground donates to us in this critical period. Some of them hasn't worked in a long time, and they have donated their hard-earned monies to us. So we should be held accountable for whatever we collect. And with our mission and diaspora desk, we are aiming to do just that. And we also had support from wide and far, Grenadians in the diaspora. For instance, in Miami, New York, Montreal, we all pulled together to make this happen. So I feel really good at where we are. We could always do a little bit more, of course, but in this period, we are looking to build bridges, not barriers. So we are going places. And I also, even if you don't send to us, but you're sending independently, that also is good. It also shows that we have a good community values within us. So I like to say, continue sending, and thank you for having that platform so we could go out further into the diaspora.
As a Grenadian in Toronto or anywhere in Canada, how would I go about connecting with your organization? Yeah, let's start with how would I go about connecting with your organization?
Okay, we have a Facebook page. It's the Grenada Disaster Preparedness Toronto. You could also call them the mission. The mission has our information. Our email address is gdpto@gmail.com. We could be reached there as well.
Awesome. And are there any initiatives currently being planned to continue support? I know the sort of flashpoint as our case numbers start to decline, thankfully, we're starting to move a little bit past the absolute critical crisis point, but that does not mean that we are out. We're not in the clear as yet. So I know you in collaboration with other organizations, you've sort of met the initial crisis need. Is there any plans to do anything beyond that? Anything coming up that you would like to let anyone in Grenada, of course, because we know how this information works, okay? So you say to someone in Grenada and it gets to Toronto before you get off this call. So
yes.
Is there anything else that you want to share with any initiatives that you have coming up?
Okay, we are engaging the leaders in the community, different organizations here, and we coordinating a drive. And we want to make it specific. What we have noticed is because we have so much of the PPEs, we're trying to shift our drive more to the needs list. from the Ministry of Health in coordination with the Office of the Diaspora. So at present, we are looking to do thermometers and glucometers. I think with that, with the strips for the diabetics and homes, I think we could make an impact in that regard. We are still receiving the PPEs. We're going to be sending for everything, but we just want to strategize and look on the needs list. There's a master list that is circulated on the Grenada Response website, or you could call the mission here, and we just pick a few items which we think we could realistically achieve to send to Grenada. So that's the driver we're on right now.
Awesome. Thank you. Mr. James, I wonder if you would like to chime in and tell us a little bit more about your needs, your needs list.
Yeah, yes, Tricia. What we did is that we, based on the needs list given to us by the Ministry of Health, we decided to concentrate on the critical things. Now that we're going through this first phase, we have to be prepared for the second or third wave. And in the interim, during the period where we were preparing, we also have to look at how we can improve our healthcare system in Grenada. And in doing so, and that's why we see we have Dr. Peters and Dr. Joseph on different ends of the spectrum to look at what could be done. And there are a number of initiatives that we're discussing right now. So what we did is to divide the needs list into regions. For example, the Grenada COVID committee, they have a list of items that they agreed on to get sourced for Grenada's development. The Grenada, Toronto, the Grenada Disaster Preparedness of Toronto has its own list. Montreal has this, London has this, New York has this, and so on. So everybody, they agreed, the different people in the different regions agreed on those lists. So the concentration now is not to get everything, everybody just send everything, but to make sure that people in the diaspora concentrating on specific things. So that's why we want to now ask the members of the diaspora to coordinate through the different committees that we have placed there in the diaspora for them. I mean, if people want to continue to send things to the respective communities and so on, that's fine. But in order for us to be prepared for everything else coming our way, we have to be able to look at that list in a structured manner and not in a vacuum way that everything we have there and everybody wants to run and take things, so that will really help us. The other thing that is critical for us is that the working with the ministry is critical for us. And so people have to understand that what the list that we have is not a list we just pull out of a bag, but it's a list that comes from the ministry, because the ministry, they are the ones who know what is needed. So we have to take that list from them. They know what was acute, critical, what is not critical, what we could put on hold for now, what we could place the emphasis on for now. And so we're doing that. And we have to remember that the diaspora is a large community. It is 3 or 4 times the size of the population in Grenada today. And to see that our diaspora is coming together to help Grenada, I mean, it's really commendable for all the diaspora, how they're working today. And that is the function of the Office of Diaspora Affairs, to really be anchored, to support, to facilitate the diaspora in making a change, making their contribution to Grenada's development. And we are now preparing to develop permanent structures. So this will continue in the development of Grenada. We don't want this to be a one-off situation. We want to make sure that we have systems in place, not just for COVID. We hope that COVID will go away soon, but we want to help in building, not just in health, but in other areas in the development of Grenada. But today, our concentration is health because it is critical. And the way the diaspora really came out during this crisis is commendable. We have to see the support the diaspora gave, and really our people here in Grenada have to look and see what our brothers and sisters do, how they care about our brothers and sisters, how they support our brothers and sisters here. And the only thing the diaspora is asking our nationals to do is to take the vaccine, protect themselves. So we would not have to work so hard, but we could concentrate on the people who have diabetes to help them, the people who have heart problems, the people who have cancer, and other illnesses. So that is what we want to concentrate on, because I think this period of COVID has really exposed what the health of our people looks like. You know, what we need to do to improve our health. We have lost over 130 of our senior citizens, you know, and a critical part of this thing too is education. And that's why we are working with an organization in New York to help us, to provide us with some literature. Education, education, education. And our people have to learn to take the knowledge from the right source. We have to learn to take the knowledge from the right source. And I'm sure that they could go to their own brothers and sisters in the diaspora and they could get good information instead of going on social media to get information from people that they don't know. And I want to say this. Some of the people who in the diaspora that may be pushing these information, I could bet my last dollar that they already took the vaccine. You know why? They cannot do anything in New York, in Toronto, without having the vaccine. In fact, people cannot even travel to the US or travel to London or travel to Canada without having the vaccine. And most people, when they hear that, they go around and take the vaccine. So I'm telling them, no, you cannot get on a plane to go these places without the vaccine. And I ask our people in the diaspora to please share the right information to our people, because they cannot go to a restaurant. In Toronto, you know, Tricia, you live in Toronto and Unison, you cannot go on a train without being vaccinated now. You have to understand that you cannot go on the federal plane or transportation system without being vaccinated. So you have to be grounded. So the vaccine is critical for us to move forward. We will help, but everybody have to help themselves. And we have to also get away from the thing, don't look for our neighbor. We have to start looking at our neighbors. We have to go back to when grandma used to say, it takes a village to mind a child. We have to go back and look at our neighbors, help our neighbors, you know, help our young children. And so these are the values that we have to get back to. And if we all work together, we will see the backs of COVID-19 in Grenada. You know, we have to get people to come home. The diaspora want to come home, but a lot of people don't want to come because of the situation. And I want to encourage the diaspora to come home. Grenada is beautiful. Come home and use the opportunity to speak to your loved ones and so on, you know, about the situation. It is tough, but we have done a good job in bringing us where we are today. But sadly, we have lost too many of our sons and daughters, especially our senior citizens. And most of it could have been avoided.
Thank you, Mr. James. Well said. Go ahead, Dr. Peters.
I just want to add something that's really important too. I see people getting all mixed up with all the stuff that they find out on social media. But I want people to make sure that they check out the source of whatever it is that they're choosing to believe. Look at who wrote the article or whatever it is, and see what they're known for, see what their qualifications are. You know, because as I said to somebody, I have family members who refuse to get vaccinated as well. And it's because of stuff on social media that doesn't even list the source. So somebody who is a landscaper who's cleaning yards for a living or whatever can give you an opinion about a COVID vaccine and you're going to accept that. Like, I have a lovely dentist, but when my car breaks down, I don't care what his opinion is about the car. It goes to the mechanic. So listen to somebody who is reputable in terms of the sources, because the biggest issue is that you do not know what the agenda is of the person who's telling you not to get it. Maybe they have a mahogany farm and they make coffins for a living. And so it would behoove them to not have people take the vaccine. I don't know. You don't know what their issue is. And so if you don't know where that person's coming from or what their agenda is, then listen to the doctors you've had forever. Listen to people who you can trust, and trust that if they've had your best interests at heart all along, they continue to do that. Not some random person that you don't even know who they are when they tell you not to take a vaccine. People actually have a belief sometimes that the vaccine is the thing that's going to hurt them. But for months and months and months now, we've known that the people who get most critically ill with COVID, the ones who are most likely to die, are the ones who are unvaccinated. And Grenada's data is bearing that out as well. Somebody's constantly putting out the numbers in terms of vaccination deaths and illness rate in Grenada. And just like everybody else, the 94% or so of your people who don't, 94% of the people are not getting sick who've been vaccinated. Like, so it's very, very important. 94% are unvaccinated, are vaccinated. So look, the odds are that you can still get it, but the odds are that you will not get so sick and you will not die if you take it. So Grenada calls itself a Christian nation, as is most of the Caribbean. That means we are our brother's keeper. Like, you have a responsibility for the neighbor and the friend and the people that you work with to keep them healthy as well. So that means you get vaccinated, you wear a mask, whether you like it or not. It's inconvenient, maybe it's uncomfortable, but we have a responsibility to protect each other. And there's nowhere more apparent than in a place as small as Grenada. So I'm just asking people to step up and take care of each other like they've done for so many years before.
Thank you, Dr. Peters. So the main thrust of that lovely speech there is protection. So any of you on the panel can take this, but maybe we start with Mr. James. We know that in the fight for we know that in this pandemic, in this fight, a lot of it comes down to protection and protecting yourself. Now, we know that a lot of our people simply may not have the resources to access protective equipment and or home care kits. Where can people get PPE and home care kits in Grenada?
I think she got frozen there. If I could follow up with the question that she asked, where people could get kits and so on, PPEs and so on. I think people could just simply call the Office of Diaspora Affairs, call the Ministry of Health. Somebody will reach out and assist people in getting, guide people, because there are masks and other PPEs that's available on the island. I also know that there are a lot of people in the diaspora sending stuff to communities, so the community leaders would have. So I don't think that there is any person who wants a mask that cannot get a mask, so it's just a matter of reaching out to the right people to get this kind of support. Just reach out. Even you call the hotline and you ask the hotline, I'm sure they could able to guide you and tell you and help you to get masks. I mean, so there's no shortage of availability or anything like that. I mean, at the end of the day, we want to make sure that everybody is protected. We want to make sure that people understand that the COVID is still alive in Grenada. So every day that somebody is tested positive, you never know who that person got in contact with and how it could spread. So I just want to encourage people. So I say, Jill. So Jill, I think you're taking over the questions now.
Just to have a follow up on what Mr. James said. They have on the Grenadian diaspora website the Grenada response in the interest of persons in the diaspora that want to donate home care kits. If you go on the website, there is Scots. You click on Scots and it will take you into the actual companies, and you could donate a home care kit from there. So you could purchase a home care kit right there, and they make arrangements to get it to Grenada. So that's another tool you could use in the diaspora.
And the home care kit is included in some of the things that one of the things that Dr. Joseph was saying about the pulse oximeter. That is also involved in the kit, and those kit was recommended by the Ministry of Health. So we asking people if they want to purchase those kits, they could go there and purchase that. I think that's one of the things that is critically in need of to assist people home. And you have masks in the kit, you have hand sanitizer, and all these things in the kit. Even some vitamins would be in the kit.
Awesome. Thank you, guys. I apologize. I had a little bit of a technical difficulty there, but I do hope that you were able to get the thrust of the question that was asked.
Yeah.
And I did a good job.
Mhm.
Great. Great. Wonderful. So we are almost at the end of our session. So what I'm going to do is I'm going to give in the order that you were introduced. I'm going to give you 2 to 3 minutes to just do a quick wrap up. You can use the opportunity to talk more about your service. You can repeat the access numbers again as or provide information about your organization as appropriate. So we will start with Mr. Joseph.
Thank you, Tricia. And Tricia, let me say thank you for all your support you have lent to the Grenada disaster preparedness. You have really been a rock for us in terms of advice, the weather doing flyer, calling late at night. So we want to say thank you, and to the team of the Grenada disaster preparedness. I also want to say thank you to the community at large. Your support over the years have been tremendous, and we look forward to continuing what we have. Also, it will be remiss of me if I didn't put our fundraiser coming up, our ham and turkey drive, which we do every year to raise funds. So we're asking persons in the diaspora in the Toronto area to purchase a ham and turkey in this time. Donate it to a friend, because not as a health panel will say, we are looking for each other. So someone may not be able to have a good Christmas, but that ham or that turkey could bring a smile on the face. So I want to say thank you and looking forward to working with everyone. And our email address is gdptor@gmail.com. And we could find us on Facebook as well. So thank you, and thank you to the panelists.
Thank you, Mr. Joseph. Dr. Peters?
I guess we didn't get a chance to get to it, but one of the things that we know is that COVID has mental health effects, that it can increase your risk of a variety of mental health issues like depression and anxiety and suicidality. And we've seen that particularly among young people. And so what I'm going to suggest to everybody is that if you know you're not coping well, don't be ashamed to go and get help. Call one of the numbers, like the district office at 440-2269 or the helpline at 440-4787. And lastly, because we know that it can actually have impacts on your mental health, and that's in a long haul sort of way as well, going on months after you're actually recovered from COVID itself, that becomes even more important to get your vaccine. Get your vaccine, get everybody that you know vaccinated within your circle of influence, because Grenada needs to get out of this. The death and suffering needs to stop, and we all have our part in it in terms of personal responsibility. So get your vaccine.
Okay, so it's my turn now, yes?
Yeah, doctor.
Thank you. So I wanted to say that I was concerned and happy to have the question about confidentiality, and as a result, I thought that I should introduce the names of the people who are on my team. We have Pastor Gilliam of the Seventh-day Adventist Church. We have Mrs. Andrew of the Roman Catholic Church, who is a Catechist and counselor. And we have on the doctors, we have Dr. Jenny Isaacs, Francis Martin, Rachel George St. Bernard, who is also the president of the Grenada Medical Association, Dr. Erlene Thomas, Dr. Daniel Thomas, who is a consultant gastroenterologist. We have Dr. Sonia Phillip, very well-known casualty charge doctor. Christopher Gilbert, Deborah Stevens-John, Dr. Doris Keynes Douglas, and Dr. Spencer, her close colleague. Both of these are working in psychiatry. Dr. Alina Wade, Sudel Bailey, Tanya Edwards, Rache Mondel George, Roxanne Lewis Roberts, And all of these are academic doctors from the St. George's University, and then Margaret Joan Joseph, myself, yours truly. I would like you to know that we do a daily 10 a.m. to 10 p.m. service, and everyone there is committed to helping the community get through this COVID crisis. And one of them even said telemedicine has come to stay. And this dovetails what Dr. Peters was telling us. So that's who we are. That's what we do. And we ask everyone to reach out who is positive or who has a relative that's positive, to reach out to us by the numbers that we have already mentioned, and which I think Jill was putting up. Yes, so I don't know if I should call the numbers again because I did already.
Please do.
Please do. Okay. So the numbers are for the hotline, and we are a department on the hotline, so to speak. 438-4787, 458-4787, 538-4787. At these numbers, just about everything to do with COVID is available because, as Mr. James said, we can help you we can put you on to someone who will give you information about other things that are not directly medical, but we will help people to help themselves and monitor them while they're helping themselves so that they can avoid hospitalization and possible deterioration into death. So this, I don't like to end on that word. We are there to help.
Thank you, Dr. Joseph. And as we wrap up, Mr. James.
Well, thank you, Tricia. I want to say thanks to the team, Jill Patterson and the team that put together this program for the last 3 or 4 weeks. I really want to compliment the team for doing that. I mean, the Office of Diaspora Affairs cannot do everything as an office, but we have to really work with everybody and so on. So I also want to thank the team that the coordinating team, the hardworking coordinating team that's with me every weekend and every day, putting everything together for Grenada. I already want to say thanks to them. And I also want to say, because I call all kind of regions, but I want to say that the Barbados diaspora has made a significant contribution to Grenada's COVID fight. And I want to say thanks to the team, the diaspora in Barbados, because, and also I want to use this opportunity to say thanks to the Commissioner of Police, because he organized the Regional Security Force aircraft to bring the supplies to Grenada for us from the Barbados diaspora. So I want to say thanks to the Commissioner of Police for his input in helping us. I also want to say to all the organizations who did this. I mean, it's a difficult time for the organizations because this time they cannot reach funds because of COVID, but they found a way to help Grenada in this difficult time. So all the organizations in the diaspora and the individuals, I want to repeat, I cannot say thanks too much to these people because they have really helped us in this difficult time. And I really, really want to say thanks to them. To the embassies and consulates, we've been working with them, and I want to tell people that they could also call the embassies and the consulates wherever they are to lend a hand of support, to call them for information, call them to make donations and so on. And I want to thank all the ambassadors and all the consul generals in this effort. And all the doctors who traveled to Grenada, I know we have a team on the ground today, for the giving up of themselves, the giving up of their time to come to Grenada to help us. I really want to thank them. And this journey is a journey for all Grenadians, wherever you are. And I'm saying, and I will repeat this to our brothers and sisters in Grenada, all we are asking you to do is to take a vaccine, go and get a test, go and do the right thing for your community, for yourself, for your children. Remember, you've been taking medication for all the days of your life. And I think you have more information what this vaccine has than any other medication you ever take before. So get on board, take the vaccine and protect yourself, protect your family, because we want to be able to have a carnival in 2022. And if we want to have the carnival and we want our jab, we must take the jab today. Thank you, Tricia.
Thank you, Mr. James, and to all of you who are on the panel. We really want to take the time to thank you for taking time off on a Sunday evening. I know this is normally family time. We want to thank you for your expertise. We want to thank you for your service. We want to thank you for your love for Grenada, which is, I think, is obvious on the call. And I think one of the things that I did not mention at the beginning is that we actually have an adopted Grenadian in our midst. Yeah. So it's not only Grenadians out in the diaspora who are rooting for our success in Grenada, but we have a lot of persons who just have a love for Grenada and they want to help. And so we thank you for your service this evening. And as we wrap up, I wanted to make mention again of, if you are in Grenada or if you are out in the diaspora and you are looking for information on the Grenadian response to COVID from a diaspora perspective, you can visit the Office of Diaspora Affairs website, and it's grenadiandiaspora.gov.gd. I hope I got that correct, as well as .gd. Grenadian response, grenadiandiaspora.gd, or you can also go to grenadaresponse.org, and you'll be able to find all of the information there that you desire. On that note, I want
Trisha, before you leave, I just want to say thank you to Kimron in the background for all the technical work, and Jill and so on in the back, those people in the background. We must say thanks to them, because without them, we would not have been in the front.
I was going to do that, but thank you very much for thank you very much for doing that. And to our listening audience, I want to thank you for tuning in again, and to ask you to continue tuning in. We're going to try to do these information sessions on a weekly basis. So look out for the information on what the topic would be for next week. We should be able to get that out maybe by about Tuesday, but we'll be right here again next Sunday at 5 p.m. on the Office of Diaspora Affairs Facebook page and on YouTube. And on that note, thank you again, panelists, and do have yourselves a wonderful evening. Good night.
Good night. Good night. Good night.